My name is Dr. Jonathan Goodin, and I'm a pediatrician at Carousel Pediatrics here in Carrollton, Georgia. We emphasize individualized care. That is, we treat each child as an individual. We listen to the parents when they come in and talk to them. We pay great attention to detail as far as providing care for those children, whether it's for a sick visit or a checkup, for example. But we, from the beginning of the process, from when they first walk in the door to when they leave, we address the patient's and family's needs in detail to the best of our ability. And that's what we try to do for every patient who comes in here. We treat a wide range of pediatric problems, the general day-to-day illnesses. We see a lot of patients with attention deficit disorder, asthma, specialized problems, things of that nature, where we can either evaluate them and treat them here or evaluate them and refer them on to further subspecialized care. As far as my personal interests, probably the two most common chronic problems of childhood would be attention deficit disorder and asthma. And I think by necessity I've acquired an interest in those two things. So those are the two most common diseases of childhood, chronic diseases that we deal with, and I have an interest in those fields. Well, there are several great things about this job here. When I interviewed here, really about a year ago, I noticed right away that it had a great atmosphere in the practice, so I think it's just a good general place to work. I think the people here do a good job of working with each other and caring about each other and caring about what they do. As far as this particular job of being a pediatrician is concerned, I've always enjoyed working with kids, and I take great pride in that. I think it's an honor to be taking care of children as a profession, and I think that I enjoy helping to shape young lives, provide good health care for young people, and eventually play a role in establishing a good future for us. I think the cornerstone of patient care is a situation where you have a patient and a physician and a parent and either a medical need that needs to be met or a problem that needs to be addressed, and giving that the best level of competency that the individual doctor has. So we strive to be competent as much as possible, also to be caring as much as possible. You can't just be the professional knowledge source who tries to have all the data at hand or at their fingertips, but you also have to care about what you do. So I think there has to be a genuine human interest in that child and their situation. I enjoy interacting with children in general. I just think children are fun. I think they're great. I also think that it's very rewarding to take a sick child and help that child get better. I also think that it's better, or that it's wonderful to be able to have the opportunity to make that child's life better when we have the opportunity to recognize that problem and do something about it.